Hello and welcome. Today we're diving deep into a fascinating and sometimes concerning topic: pancreatic cysts. We'll explore what they are, why they form, how they're diagnosed, and what can be done about them. Join us as we unravel the complexities of this digestive system disease. So, what causes these cysts to appear in the pancreas? Well, the etiology is varied. Some pancreatic cysts are congenital, meaning they're present at birth. Others can be linked to conditions like chronic pancreatitis, a long-term inflammation of the pancreas, or even pancreatic trauma from an injury. Additionally, certain genetic conditions, such as von Hippel, Lindo syndrome, and cystic fibrosis, can increase the risk of developing these cysts. In many cases, the exact cause remains unknown, which we call idiopathic. To understand pancreatic cysts, we need to look at their pathophysiology. A pancreatic cyst is essentially a fluid-filled sac within the pancreas. These cysts can arise from a variety of mechanisms. Some form when pancreatic ducts become blocked, leading to a buildup of pancreatic juices. Others develop as a result of inflammation or injury, causing fluid to accumulate. The key thing is that these cysts can compress surrounding tissues or ducts, disrupting the normal function of the pancreas and potentially causing complications. How common are pancreatic cysts? Epidemiology studies show that they are more prevalent than previously thought, especially with the increased use of abdominal imaging like CT scans and MRIs. It's estimated that a significant percentage of the population may have a pancreatic cyst, often without even knowing it. The prevalence increases with age, and men and women appear to be affected equally. While many cysts are benign, understanding their prevalence helps us track and manage their potential risks. Many pancreatic cysts are asymptomatic, meaning they cause no noticeable symptoms. These are often discovered incidentally during imaging for other reasons. However, if a cyst grows large or is located in a sensitive area, symptoms can arise. These may include abdominal pain, often in the upper abdomen, that can radiate to the back. Other symptoms can be nausea, vomiting, loss of appetite, weight loss, and, in some cases, jaundice if the cyst blocks the bile duct. Rarely, if a cyst becomes infected, it can cause fever and chills. Diagnosing pancreatic cysts usually involves a combination of imaging and fluid analysis. Initially, a CT scan or MRI is typically used to visualize the cyst and assess its size, location, and characteristics. Endoscopic ultrasound, or EUS, is another valuable tool. This involves inserting a small ultrasound probe down the esophagus and into the stomach, providing a very detailed view of the pancreas. EUS allows for the possibility of fine needle aspiration, or FNA, where fluid from the cyst is collected and analyzed in the lab. The fluid analysis can help determine the type of cyst and whether it contains any cancerous cells. Pancreatic cysts aren't all the same. They're broadly classified into neoplastic and non-neoplastic cysts. Non-neoplastic cysts are generally benign and include pseudocysts, which are often related to pancreatitis. Neoplastic cysts, on the other hand, can have the potential to become cancerous. The most common types of neoplastic cysts include mucinous cystic neoplasms, or MCMs, intraductal papillary mucinous neoplasms, or IPMs, and serous cystic neoplasms, or SCNs. Distinguishing between these types is crucial for determining the best course of treatment. Treatment for pancreatic cysts depends on their size, type, symptoms, and potential for malignancy. Small, asymptomatic cysts may only require monitoring with periodic imaging. Larger, symptomatic cysts or those with concerning features may need intervention. This can involve endoscopic procedures, such as cyst drainage or surgical removal of the cyst. The specific approach is tailored to the individual case, considering the risks and benefits of each option. For cysts with a high risk of cancer, surgical resection is usually recommended. Unfortunately, there's no definitive way to prevent all pancreatic cysts, especially those linked to genetic conditions. However, certain lifestyle choices can reduce the risk of developing pancreatitis, which is a common cause of pseudocysts. These include avoiding excessive alcohol consumption and maintaining a healthy diet. Managing underlying conditions, such as high cholesterol or diabetes, can also contribute to pancreatic health. If you have a family history of pancreatic disease, discussing screening options with your doctor may be beneficial. The prognosis for pancreatic cysts varies greatly depending on the type of cyst and whether it's benign or malignant. Many benign cysts can be managed with observation or minimally invasive procedures. However, neoplastic cysts, particularly those that become cancerous, can have a less favorable prognosis. Early detection and treatment are critical. Recent research has focused on improving diagnostic techniques, such as advanced imaging and molecular analysis of cyst fluid, to better predict the risk of malignancy. There is also ongoing research into targeted therapies for pancreatic cysts with cancerous potential.